Traction and extension and inflection. We did medial lateral glide. Now we're gonna switch over to the radius. So we're gonna use a little 3-finger grip here, okay, on the radius itself. Remember the radius is thumb side, and we're gonna do distraction. And then we're gonna do a palm on palm grip here, and we're gonna do compression. And now we're not moving the olecranon, so now you want the elbow on the table. Before the elbow is off the table, now we want the elbow on the table. So what are we doing here? The radius is the yellow bar. The humerus is, the radius is gonna pull off the humerus this way, distraction, or we're gonna compress it in. Now, what are the findings with this? As always, it's joint mobility. So we're assessing how much it moves and what's the end field. The end field should be capsular here, and it should be kind of cartilage here, okay? If this feels worse, it's a capsular ligament problem of the humeral ulnar joint, of the humeral, which is the annular ligament, the humeral radial joint. We'll do annular ligament in the cases, and it's some kind of type 1 collagen is the point. When distraction hurts, it's some kind of type 1 collagen. If distraction feels better, it's cartilage. If compression feels better, okay. Again, it's probably, they probably had a pull injury. You see this with little kids, their parents yank their arm, so they have a subluxation. So this would be something you treat if that feels better, okay? If this feels worse, they either have a cartilage dysfunction, like so a sprain, or they have a radial head fracture. Now, how can you tell if it's a radial head fracture? Obviously, the correct answer is X-ray, but you also can take out one of these. And I find if you put it on the radial head, it could just be sore because it's sore. So what I like to do is put it at the distal radius, and if that reproduces pain here, they probably have a fracture, okay? And that's because the vibration is traveling down the radius and vibrating the fracture site. You still can't tell the patient they need a fracture, but if that's positive, my treatment's over for the day. And I'm making calls in front of the patient to see if they can get in to see one of my orthopedic surgeon friends, because that's a great opportunity for you to make a friend with an orthopedic surgeon. Or if you can't get a hold of somebody, send them to a walk-in clinic, okay? Now, I learned this after COVID. I went to have my mom get an x-ray, and because she rolled her foot and it was pretty bad, and she went to a walk-in clinic, and they had an x-ray machine, because I had called ahead. I was like, hey, do you guys get x-ray? Yeah. What they didn't tell me was, oh, but we only have an x-ray tech on Thursday. Well, okay, so that doesn't help, right? It's like, I'm calling to ask you, okay, I'm sorry I wasn't specific enough with my question. Basically, I'm asking you if you could perform an x-ray today. So I said, okay, I'll be right in. They're like, okay, bye. And my mom showed up. I told my mom, go to the place right around the corner. So she ended up going to the emergency room. But my point is, have the patient call ahead, because there is a shortage of healthcare workers all over the place, okay? And if you have nieces or nephews or kids that are getting to the age on